So you've sent in the picture, and I would like to have a look at the picture. And I can see that your lesion is, as you described it there, it looks like it has an induration in the middle, but it's quite clearly demarcated. And you mentioned that it's not getting bigger, but it has a few symptoms. So usually when a lesion like this is on your face and it's starting to get symptomatic, we do need to just stay on the safe side. Now, it could just be, a simple lesion, but sometimes there are types of skin cancer, both, slow growing and fast growing skin cancers that we want to stay on the lookout for. Is that clear so far?
Yeah, Doctor.
2 minutes remaining.
Yeah, I'm a bit concerned because you have been exposed to the sun in the past and you've had a lesion before that was removed, okay? Because you've got symptoms, and you mentioned some pain in there, I think it's the right thing to suggest that we make an urgent referral for you to see a skin specialist. Is that okay?
Oh, yeah, Doctor. That would be fine.
Okay. Look, your voice sounds a bit worried and concerned. I can understand where the worries come from, but I want you to know that firstly, it's just to be on the safe side. They're going to take us, they're going to do a biopsy, take the lesion and send it to the lab and look for any, sort of problems. And I want you to know that not everyone who is referred, okay, under the cancer pathway actually ends up having cancer.
Okay.
Okay. Feel free to take someone with you to the appointment. Okay. And if you miss your appointment or you don't get the letter, please come back immediately so I can forward things for you. Okay.
Yeah, that's fine, Doctor.
Okay. So usually, look, if it needs treatment, it might be surgical to remove it. There might be other options as well, but there is treatment available, and it's very much something that we want to be on the safe side of. It looks like a basal cell carcinoma, which basically is a slow growing type of skin cancer that doesn't really cause problems. But because you've got the pain in there, we've got to make sure it's actually that and not something a bit more serious that grows faster. Is that clear?
Yeah, Doctor. Oh, no.
Okay. What I'll do is I'll email you a leaflet as well so you can read up on that. Look, we just want to make sure that everything's okay and be well ahead of things if things are not normal. Okay.
Okay, Doctor.
Okay. Do you have any other concerns at all about the lesion or any worries?
No, Doctor. I'm just worried now. I'm just waiting for the referral.
Of course, understandably so. Look, you can
move on to the next station.
So my time is over.
Perfect.
Yeah, my time is over. So there you go. A little example of how things can go. Dr. Nida, feedback, please. Honest and...
So starting from everything, so that there is a call, so there's a proper thing that you have to follow when you are on the call. So you follow those, that criteria. Then history taking was perfect. You were like, I was showing, I'm a bit upset. You were covering that as well. So always like, as you mentioned in the diagnosis part, so everything was perfect, Dr. Radwan. I don't have anything to say.
I think one thing, yeah, when it's suspected cancer,
Yeah.
right? I think the safety netting should have included also from my side, perhaps, if you don't get an appointment with a letter within 1 week, also come back. So if you miss your appointment, or
you said that.
Did I say that?
Yeah, you said like if I'm not going to get the letter, I should contact you as soon as possible.
All right, that's great. Okay then. Yeah, so that's that. Thank you very much.
Get the letter by post. Yeah, you mentioned it, and
yes,
this is the.
Yes, thank you so much, Dr. Nida. Hopefully we'll have you here for the next hour. Do we need to ask flaws in such cases? Yes, you should ask for symptoms, yes, because if you're suspecting cancer, you do need to ask flaws, of course.
Especially a rash which is there for a long time. So it's there for 6 months. You must ask, and the age as well.
Yeah, so the age, obviously the age there is a 60-year-old. Let me just go back up there. So this is it. Okay, so again, now Dr. Nida gave me some symptoms. So because of that, I decided to go for an urgent pathway. But even if there were no symptoms, it's on the face, okay? And it could be painful. It's a reality. It could be painful as well, okay? So we are going to do the cancer urgent 2-week pathway. If it's on the hairline, okay, it's still on the face and, due to location, we still do an urgent one. But if it's on the back of the head, for example, and 3 years ago they had cryotherapy, it could be a routine referral because basal cell cancers are slow growing, okay, cancers. And, we can make a routine referral, especially if someone has had basal cell cancer in the past. So you got to make sure that you also recognize that. Good. So today is all about seeing how we can do this in 8 minutes, seeing what we can learn. Next one here is a 62-year-old man. He presented with a lump. Okay, he presented with a lump. Now, I can go again. And if you're feeling up to it, Nida, you can go. Otherwise, I'll do it. No problem. Actually, I feel like doing this one as well. So this is an example of maybe an SCC. Yeah. So, yeah. So let's say it's behind the ear like this, okay? This is the picture, yeah? So you're the patient, Dr. Nida, and this is going to be where your lesion is. Now, I've decided to put it behind the ear, right? Because there's some interesting information to get across from this one. So you're going to do this one, Dr. Nida, and we need to learn a bit. Here is a scenario of rheumatoid arthritis, a comorbidity on methotrexate, which causes immunosuppression. Okay. Now I know it says it's on the elbow, but change it to
ear.
the ear. Okay. Change it to the ear. All right. So when somebody has a lesion on the ear, and they've got rheumatoid arthritis, they're on methotrexate. Some of your DDs also include otitis externa and things like that. But definitely it could also be cancer. So that's why I decided to put that out there like this. Hold on, let me see here. It's acting funny. 1 second. Let me fix this. There we go. Here we are. Time for go. Right.
Yeah.
And
Again, enter the room.
hello.
Hi, doctor.
Hi, my name is Dr. Radwan Ali, and I'm one of the doctors here in the GP surgery. Can I just confirm your full name and age, please?
Yeah, doctor, it's Mantha Smith, and I'm John Smith, and my age is like 62.
Okay. Very nice to meet you. What can I call you today?
John is fine.
Okay, John. How are you? How's everything going in general?
I'm fine, doctor. I'm just here for a lesion that my wife just pushed me to come here.
Right. Okay. Okay. So can you tell me about this lesion? Where is it exactly?
The lesion here, I have this lesion on the outside of my ear, the outer, yeah.
Okay.
I
And
I can't see it, but she noticed it, and
okay, she noticed it. Okay, did you manage to get a look at it? Is it one lesion or more than one?
she told me it's one.
Okay, okay. And when did you notice it initially?
It's like a month ago.
Okay, a month
One is
ago.
the yeah.
Okay. And is the lesion on top of the skin or under the skin?
Top, I would say. What I can feel, yeah.
Okay. Have you noticed any color changes at all? Is it the same color as your skin?
She told me it's pink in color.
Okay, she told you it's pink in color. Is it pink all over, or are there different shades or anything else going on in there?
She said like it's a pink, and the center is a bit like couldn't like describe, but the center is a bit different.
Okay.
But overall,
Different.
it's pink.
Any dark pigmentations at all?
No.
Okay. What about the borders? Is it a clear border or is it irregular in border?
The regular, yeah.
Okay. Okay. How big is it?
Oh, it's a small, just like the pea size.
Pea size. Okay. And it bumps out, is it?
Yeah.
Okay. Okay. And does it have symptoms like pain?
But yeah, doctor, it's quite painful sometimes and itchy as well. Yeah, quite itchy.
Painful and itchy. Okay.
Once I scratched it, it like started bleeding as well. So
started bleeding as well. Okay. Is there any discharge or oozing as well?
Little bit yellowish discharge I noticed.
Yellowish discharge as well.
Yeah.
Okay. Are you by any chance, running a temperature?
No.
Not running a temperature at all. Okay. Any hearing problems or anything like that?
Oh, no, doctor. No.
Okay. Okay. Would you say it's increasing in size at the moment?
No, it's the same.
Okay. It's the same. All right. Okay. And no changes in the general sensation around the area?
Not really. No.
Okay. Is the skin in your ear and around the area changed in any way, or is
No, my wife said she didn't. She just noticed this. I can't see it. I can't see in the mirror. Yeah, it's
right? Okay. Fair enough. Fair enough. Have you got any other lesions anywhere else on your body, or any rashes or anything like that?
no, doctor.
Okay. And I did ask you about a fever and hearing problems. Generally, do you have any other symptoms like, tiredness, weight loss?
No.
Okay. All right. And any sort of balance issues?
No, doctor.
Okay. All right then. Thank you very much for answering my questions. I just want to ask now, do you have any medical conditions at all?
No, doctor. I'm perfectly fine.
Okay. And are you on any medication?
No.
Okay. Are you allergic to any medication?
Yeah.
Sorry?
No, doctor. Just take the vitamins, just to
Oh,
get.
your vitamins. Good, good, good. Yeah. And no allergies that you know of. Is that right?
No, doctor.
All right. Sorry to ask you this. I do have to ask. Is anyone in your family ever been diagnosed with any type of skin cancer in the past?
Yeah, doctor. My father actually had. I don't remember the name, but yeah, he had this.
Okay.
Yeah.
And what about yourself? Have you ever been told that you have any
Oh,
type
no,
of skin cancer?
never, doctor. Never, never.
Okay. Just a few questions. Have you, by any chance, traveled or lived abroad in the past?
Oh, yeah, doctor. Actually, I worked in China for 3 years and then in Australia. And, my work was usually outdoors and the weather, it's perfect.
Okay, it's perfect. Yes, oh, I can imagine. It's not like the UK, is it?
Oh, I love it. That's why I prefer working there.
Okay. Do you still work there at the moment?
Oh, no, doctor, I'm retired. So now back to my place.
How are
Yeah.
you enjoying retirement?
Oh, yeah, yeah, it's good. But
Okay.
work is also, I miss those days. Yeah.
Okay. So you were exposed to the sun a lot in the occupation?
Oh, yeah, I work outdoors most of the time. Yeah.
Okay. Okay. And do you also sunbathe or things like that?
But yeah, all the time, the summers and the beach and.
Mm. Any tanning indoors or outdoors?
No, no.
Okay. Okay. Thank you so much for answering my questions. Just a few lifestyle questions, and I do want to know, who else is at home? You did mention your wife. Is there anyone else at home at the moment?
No, just me and my wife.
Okay. And do you by any chance smoke?
No, doctor.
Okay. Do you drink alcohol?
Yeah, occasionally, not like too much. Yeah.
Fair enough. Okay. Do you get to move around, enjoy your hobbies day to day?
Oh, yeah, yeah, yeah.
Yeah, no problems with movements or
No,
anything
no.
like that. Yeah. Okay, good. Okay. And are there anything stressing you, worrying you at the moment?
Not me, but my wife is just putting like panic
Okay,
about this. She's saying like, this could be something sinister.
I see. Have you given any thought to what the lesion could be?
I don't know, doctor. It's just, it happened once in the back as well. It
2
was
minutes remaining.
here on my forearm and it went
All
away.
right. Okay. Okay. So I'm just going to have a look at the lesion if you don't mind. I'd like to also check your blood pressure, your oxygen levels, just a general vital signs, and have a look at the lesion as well. I'm having a look here, and I can see that it's your ear, like you said, it's round and popping out as well, and there's a bit of stuff in the center, like you said, a little bit of crusting. Okay. Look. Sometimes when you have a lot of sun exposure in the past, and you've got a lesion on, say, your ear, we as medical professionals, we need to make sure that a lesion like this isn't caused by any kind of skin cancer. Okay.
It could be cancer, doctor.
Again, there's no way of knowing for sure until we do further tests, but I do need to let you know that it could be something that's quite simple. But because you've been exposed to the sun, and because you have someone in your family who's had cancer before, I think we should be on the lookout, and we should take some important steps. What do you think about that?
Oh, yeah. What are you going to do now, doctor?
Well, I'll refer you under the cancer service to see a specialist dermatologist in 2 weeks. Okay. I know it sounds worrying, but not everyone who's referred ends up having cancer. They just need to make sure they take a sample, send it to the lab. You know, it's called a biopsy. And if it does turn out to be cancer, treatment is available. I need you to know that as well. Okay.
Okay, doctor.
Sometimes, yeah. So they'll just try and destroy the cancer cells with maybe chemotherapy and things like that. I'll give you a leaflet so you can read up. Please take someone with you to the appointment so that it's not so stressful. It's going to be in 2 weeks' time. I'll make the referral today. You'll get the appointment within 1 week, okay?
All right. Thank you so much, doctor.
Okay, so if you don't receive the letter or you miss the appointment, please do come back. Again, I'm just concerned about the fact that you've had the sun exposure.
Move on to the next station.
All right.
I think I messed up in 2 scenarios at the same time, the forearm one, but it was
It's okay because these little particulars don't generally matter apart from the general main history taking.
yeah,
So,
just to let everyone know that I messed it, not Dr. Radwan.
so Romesa asked, can I ask, why did you ask about balance problems? What did you rule out? Because it's the ear, okay, I ruled out a fever, I ruled out infection and obviously any balance issues because it's the ear. Okay, and we want to know if this by any chance could have spread around. Yeah, if it spreads in this area, you know, it can affect nerves in one way or another, in a long way. It's a long one, but I got to be a safe doctor. So I'm asking about balance problems because it's the ear. And I also probably should have also asked about weakness in the face, but I asked weakness in general. So that's fine. Can you please repeat how to give provisional diagnosis? Dr. Aisha Bashir is asking. Yeah, I think I'm going to be doing back-to-back simulations as much as I can so we can get that. But again, you have to just be open and honest. You have to raise your concerns sensitively. So, you know, Samantha, I am a bit concerned about the lesion today, right? I'm a bit concerned about the lesion. Sometimes, okay, sometimes a lesion could be something simple and it doesn't cause any problems, but because you mentioned to me that you had sun exposure, quite significant amounts of sun exposure, and you mentioned that your family member also had cancer in the past, skin cancer, it's important that we don't miss out on something serious, okay? It's important that we don't miss out on something serious. Good. So balance problems will come if there's anything in inner ear. Yes. Patient has lesion on external ear. Yes. But again, otitis externa is in there. And if somebody has any sort of comorbidity in there, sometimes, you know, the lesion, it could be at a very advanced stage and it could be any osteomyelitis, anything like that. In general, I think asking about balance problems, it specifically may not be needed if I've already asked about weakness and it's not there, hearing problems and it's not there, and infection signs and symptoms and it's not there, and there are no comorbidities. So we can chalk that one question of balance problems as unnecessary, and that's fine. We can move forward from that. I don't think it costs too much in any case. So, you know, hope you'll let that one go. Now, for your 55-year-old male, who came with some concerns, okay? A 55-year-old male who came with some concerns. This here is rheumatoid arthritis with a patient on methotrexate, okay? It's rheumatoid arthritis, and the patient is also on methotrexate for the last 5 years, okay? So we noticed a lump on the forearm, just below the elbow, increasing in size, pinkish, itching, and bleeding on touch. The patient likes to sunbathe, likes to work outdoors. We've got the usual risk factors. Again, here, the additional history is to check on the rheumatoid arthritis, the management, if they have any pains, any joint pains, and is the pain well controlled. The patient may feel that the cause of the swelling is an infection. So obviously, you need to use your provisional diagnosis strategy in a very good way. So we've done a lot of these. I don't know if you want to give one a go, Nida, to give us a variety, or if you want to do this one and I can be the patient, or
You can do this one.
Yeah, I'll do it. Yeah. So be the patient for me as well for this one, so we can cover the bases. We're doing as many exposures as we can. So guys, hopefully you're learning from this and you're learning from that. The way we do our full course is that we talk about how to take history. And when we talk about how to take history, we then put it into practice to see how it's done in 8 minutes. Okay, so is it important to ask about regular medications in skin scenario? Urvashi, yes, it is. Because if you miss the fact that the patient is taking methotrexate sometimes, so remember one more time. I think what I'll do is I'll show you guys the approach one more time. A lot of people joined a bit later, isn't it? And they didn't see the full approach, right? So I'm going to remind you guys what to look out for in different areas. And you're just, again, okay, what does it mean to be a safe doctor? Listen, once you know how to take the history, you just need to calm it down and you need to recognize lesions and risk factors. Yeah. So, okay, where's the lesion? How many, is there more than one? Okay. How big is your lesion? Okay. Is it under or above the skin, the color, if it's regular, the margins, if they're regular, okay, and the appearance in general. Good. Make sure you cover from Odipara, you're covering onset, duration, and progression in general. And there's multiple ways of asking onset, duration, and progression. And so hopefully you'll see different ways of these things being done. How long have you had the lesion? Did it come on suddenly or gradually? And is the lesion getting bigger? The duration is important because remember, skin lesions, they tend to be around for a long time. And in older individuals above 60 years of age. That's why we're focusing on cancer a lot. Okay. Now, again, what symptoms? If you ask open-ended, they can give you some clues. Otherwise, go for your closed-ended and look into the, immediate symptoms of pain, itching, tingling, bleeding, and things like that. Also, any changes in the surrounding area, any other lesions anywhere else. Okay, and then your P. maftosa. Before your P. maftosa, please ask about cancer symptoms and ask about fever and any other DD that could present in this area or present as something that is contributing. Okay, so that's why I was asking a lot about weakness, tiredness, appetite loss, maybe weight loss in there as well. So P. maftosa, for your maftosa, again, you don't have to ask about these specifically. I'm just giving you an idea, right? But you're just going to say any medical conditions, chronic medical conditions. Someone may have diabetes, someone may have rheumatoid arthritis, and this is known as a comorbidity. And then obviously what they take in terms of medications, you need to watch out for things that could be contributing. So we're going to be fine. There's also a family history of skin cancer. Okay, there's also a family history of skin cancer you need to make sure you don't miss. So do your maftosa as we did before. Nothing has changed. Good. Ideas and concerns and expectations. I want you to know that your ideas and concerns are the most important, but sometimes, you can ask, is there anything in particular you're hoping we could do about the lesion for you? The effects of the lesion and examine and finish the station. So on theory, things look, very vast, but in practical, it's 1 or 2 searching questions. And in this exam, your IPS is about how you approach the station. Yeah, remember this, and remember this very, very well for yourselves because it's going to help you practice. How did you approach the station? How you used open-ended and then closed-ended, and then obviously building rapport. How are you today? And things like that. So please be pleasant, and I know you all have it in you, so that's fine. Never focus too hard on knowledge in this exam. Don't focus too hard on knowledge, but yes, recognize the picture and recognize what to do. They want to see a doctor who, at the minimum way to pass in this exam, the minimum, like a borderline pass, is a doctor who is safe under supervision. So you will be a doctor who is going to have supervision and is still able to be safe even under close supervision. The way you fail is if they feel that someone, even under close supervision, cannot be a safe doctor. So again, remember, what does it mean to be under close supervision? Informing your seniors and things like that, they always do play a role. Anyway, I don't want to talk too much. I do not want to talk too much. I got one more thing to tell you guys about these, rheumatoid arthritis. Sorry, not rheumatoid arthritis, but the description of squamous cell cancers from the guidelines themselves. Look, if your patient has, a sore or spot, like we've been talking about lesions, but sometimes they can describe it as a sore, a spot, and it's not healing. They can say, doctor, I got this ulcer on my elbow and it hasn't been healing and it's been there for 4 weeks and it's not healing. Or there's pain, there's itching, there's crusting, or it's bleeding. Again, duration more than 4 weeks. Or okay, where the skin is broken, there's an ulcer again, and it's not healing. So a non-healing ulcer is a very common presentation as well for squamous cell cancers, and I need you guys to pay attention to that description. Now, for SCCs, sunbathing, methotrexate, immunosuppression. These are your risk factors, okay? Like sun exposure, maybe, being, having a comorbidity that causes immunosuppression is what we're talking about. The referral is 2 weeks. Some extra knowledge in there. When somebody has rheumatoid arthritis and is on methotrexate and presents with eye symptoms, on the day when we're doing ophthalmology scenarios, you'll see scleritis in there. It's a newer scenario. Scleritis, the risk factor for scleritis is rheumatoid arthritis, and the patient is on methotrexate. Another one that I want you guys to know about is a rheumatoid arthritis patient on methotrexate with ear pain. Again,